Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order, and this is quite convenient for the study. I hope you will make use of it. Thank you very much. Now, my dear friends, in the last class, we have seen about Nabhi Nalakartana and its concepts in Ayurveda. Charaka and Sushruta mentioned that cord has to be cut by 8 angular length, which has got its own logic. Sushruta mentioned it should be cut by 4 angular length, which is again quite convenient for the normal babies. So each and every concept which is explained in Samhitas has got its own advantages and as well as limitations. That is true with the present day modern science also. Anyway, today we will discuss one more important step in the Navajata Shishu Paricharya, which is mentioned in Ayurveda, that is Mukha Vishodhana. Mukha Vishodhana. So Mukha Vishodhana is nothing but cleaning of the oral cavity. It is cleaning of the oral and as well as nasal cavity both. So Mukha consists of many 7 angas are there. So Nasa, lips, then Danta, so everything comes under the Mukha. Therefore, Sapthanga Mukha Muchyate. So therefore, even oral cavity and nasal cavity, that also comes under the purview of the Mukha. So when I say Mukha Vishodhana, it is cleaning of the oral cavity and as well as nasal cavity. So what is explained in the science by Charaka is Atasya Talvoshta Kanta Jivha Pramarjhanamara Beta Angulya Suparilikita Nakaya Suprakshalito Upadana Karpasapichuna Matya Pratamam Pramarjitam Asya Chasya Shirastalu Karpasapichuna Snehagarbhena Pratichadayet Tato Asya Anantaram Saindavopahitena Sarpishaha Karyam Prachardanam. Very clearly mentioned two important procedures. Number one is cleaning of the oral cavity and the nasal cavity and the precautions and methods. Number two is Tato Anantaraha Saindavopahitena. This refers to the present day context of cleaning of vulva and as well as stomach wash. So we shall see this in detail. Now this procedure is done immediately after the birth. That is Mukha Vishodhana. Yes, oral cavity and nasal cavity has to be cleaned immediately after the birth. This is very important to maintain the patency of the airway. So as to maintain the patency of the respiratory tract and to facilitate the easy ventilation, oral cavity should be cleaned by a mucus sucker or a mechanical sucker in the present day practice. And oral cavity, pharynx, palate, oropharynx, vocal cord area should be also cleaned thoroughly. Although the thorough cleaning is required in a meconium stained baby, of course, a thorough cleaning is must in case of a meconium stained baby, including the vocal cord area. And once this is over, then you have to go for the nose. Then nose has to be cleaned for its secretion. First, we should not clean the nose. The reason is very simple. When you put the tube inside the nose, it may initiate the cough reflex. Then the fluid which is present in the oral cavity already can be get aspirated. To avoid this particular situation, we first clean the oral cavity from all the secretions, and then we will move on to the nose for the cleaning. So prior cleaning of the nose may initiate the cough reflex. Okay, so therefore always yum come first, then comes yum in the alphabet. Always yum come first, then comes the yum. Similarly, first mouth and then nose. Now what Ayurveda says is finger with the clean and trimmed nail, suparilikita nakhaya, finger which is clean and also trimmed nail can be used to clean the oral cavity wrapped with a gauze piece. Practically in many situations, although we have got mucus sucker, a mechanical mucus sucker, etc., but practically in many situations this is quite useful. Gauze piece, practically in many situations as this is more convenient. Ayurveda explains cleaning of the oral cavity by fingers. Okay, so by the index finger especially. Okay, so the cleaning has been mentioned. Now what Charaka says is by using the index finger, which is clean and with the trimmed for nails, should be wrapped with a gauze piece, and by maintaining the aseptic condition, the secretions present in the talu, khanta, jihva, etc. should be clean. Then a cotton piece soaked with grita or taila should be kept over the anterior fontanelle, and then the stomach should be cleaned off from the amniotic fluid by inducing vamana. Saindhava and grita should be mixed together and then given for swallowing, followed by mechanical stimulation of the throat, which induces the chardana, and this helps to clean the amniotic fluid from the stomach. And at times the spontaneous vamana may also takes place. Now this is what is told by Charaka. Now the last procedure where Saindhava and Grita is given for the swallowing, and then baby is swallowing it, then we are inducing vamana. In the present day scenario, this is a quite risky phenomenon. One thing is we have to test whether the swallowing reflex has been developed in the newborn baby or not. Before that we cannot give it. Otherwise it will cause adverse problems. So I think to avoid this risk, nowadays the same procedure has been replaced by stomach wash. So stomach wash, where you are not giving anything for the swallowing, rather you are putting a tube inside and cleaning the oral cavity and as well as the esophagus and stomach from the amniotic fluid. Again, for the cleaning of the oral stomach wash, cleaning the oral, stomach area, what we are using is sodium chloride solution, which is nothing but the liquid form of the Saindhava. So previously they may not be knowing about this particular procedure, therefore they are inducing vamana, spontaneous vamana, vomiting, to clean the oral cavity in a safe position, maybe keeping the baby in the downward position, etc. But nowadays we have got more sophisticated methods, so probably we are changed, and it is wise to change this risky procedure with the present day concept of a stomach wash. Similarly, what Sushruta says about this procedure is, at the time of the birth, baby will be covered by a covering called as ulba. This ulba is a sticky material of membrane covering the baby. Ulba may be a Vernus caseosa, or ulba may be the amniotic secretions also. Sushruta not mentioned it. He mentioned that baby will be covered by the vulva. If you look into the skin portion of the body portion of the baby, baby is covered by the Vernus caseosa. But if you look into the hollow cavities of the baby, like stomach, maybe the oral cavity, nose, etc., so baby will be stained with the amniotic fluid. So anyway, vulva may refers to both. Okay, it may be Vernus caseosa or it may be amniotic fluid. So now this has to be removed. Now this has to be removed from the mukha and also rest of the body. Especially in the oral cavity, Saindhava and the Grita should be applied to remove the sticky secretions. And this is followed by keeping cotton gauze over the talu pradesha after soaking it with the oil. Now here, compared to Charaka, what Sushruta says is, Sushruta is not telling that you have to induce the spontaneous vamanam, chardhanam. Chardana is not mentioned. He is just telling that you have to apply the Saindhava and Grita paste over the oral cavity and then clean it. So that will going to remove the sticky materials which is present, or secretions which are present in the oral cavity area. And he is not talking about inducing any spontaneous chardana or sadhyavamana like conditions. But he mentioned one more thing. Immediately after doing this, you have to cover the talu pradesha. That means the talu pradesha may be referring to the anterior frontal area. Okay, so anterior frontal areas or scalp area, so that has to be covered by a gauze piece which is soaked with the oil. So this has been mentioned by Sushruta. Now talking about Vagbhata, so he gives a different opinion. So Vagbhata says that by using the index finger, Tarjani, the finger mentioned is Tarjani finger of the right hand, after trimming the nails and washing properly, talu should be lifted up. Okay, talu should be quite lifted up, and the oral cavity should be cleaned to its maximum extent. Lifting the talu above by index finger exposes the area just like cleaning by a laryngoscope. Now he is very clear here. Vagbhata says that we use the index finger and lift the talu pradesha so that underlying the mouth area where two important openings are present, like the esophageal opening and tracheal opening, that will be very clearly visualized, and then clean it. Now this concept is almost similar to laryngoscope. In the laryngoscope also, first we introduce the laryngoscope and then we lift it upwards so that the underlying area will be visualized. Okay, so this is followed by the application of Sneha Pichu over the Shiropradesha. So this is same as that of a Sushruta. Sushruta also says that Sneha Pichu should be applied over the Shiropradesha, and even Vagbhata also says that it should be applied. Therefore, I always say the Vagbhata's explanation is more matching with the present day scenario. He is also telling that just like a similar situation where we are using the laryngoscope. The function work done by the laryngoscope is shortly explained by Vagbhata also by telling that talu should be lifted by the index finger. Instead of laryngoscope, he just told that index finger, Tarjani should be introduced inside and talu portion should be lifted up. Anyway, Vagbhata, that is Ashtanga Hridaya and Ashtanga Hridaya also says the same thing, and as far as this is about this is told in Ashtanga Sangraha, Ashtanga Hridaya. But when you look into Ashtanga Sangraha, so there he that means merged opinion of all the authors. It's a mix-up opinion. I think you know that in Ashtanga we have got Ashtanga Hridaya and Ashtanga Sangraha. Ashtanga Sangraha is the old book, Ashtanga Hridaya is the latest book. Ashtanga Hridaya explains this practical explanation. Ashtanga Sangraha, there is a merged opinion is there. Now lastly, comment on this particular Mukha Parishodhana. Mukha Shodhana, Vishodhana. What are the comments that you have to take for the present clinical practice? Throughout this procedure, one thing is very clear that they are very keen to maintain the aseptic measures. Suparikilitanakataya, washing should be done, it should be very clean, nail to be trimmed. So everywhere they have taken the aseptic measurements. Okay, so proper aseptic measures has been followed. Number two, they mentioned Tarjani finger or index finger. It should be inserted to the maximum possible extent, which is nothing but helpful in visualizing the oral cavity, just like a laryngoscope. Laryngoscope has got two functions. Number one is it is a guide for introduction of the endotracheal tube. One more is by using the laryngoscope you can also clean the oral cavity up to the maximum vocal cord area. Okay, now cleaning the oral cavity, nose, body not only maintains the patency but also initiate the respiration by sensory stimulation. Now here, yes, you have to clean the oral cavity, nose, etc. So one is airway patency is maintained, but in the meantime it also gives some sensory stimulation, and we know that sensory stimulation is very important for the stimulation of the respiration. Now one more thing which comes here is word ulba. Now ulba should be taken as a sticky secretion in the oral cavity due to Werner's caseosa. But there is a disease mentioned by Vagbhata also in the form of in the name of ulbaka. Okay, so here ulbaka kantesya kafasajjite. So that means avamanat. That is, ulbaka can be better taken as amniotic fluid, garbhodaka, as it is mentioned in the context of ulbaka roga also. Okay, which leads to ulbaka roga. But word ulba can be taken preferably with the Werner's caseosa and other secretions. One more is application of the pichu over the anterior frontal and head is to protect the weak part of the head. We know that anterior frontal is one of the weakest part, but as we know, head region forms the greater part, 20% of the surface area of the baby, and the temperature loss through the head and forehead area is maximum, so which may lead to hypothermia. So therefore Ayurveda in all the steps they say that Shirasta talu Sneha Pichuna. That is, the talu, scalp area and Shira Pradesha should be covered by the Sneha Pichu applied with the oil, cotton piece applied with the oil, so that temperature loss will be minimum or negligible from this particular area. So that suggests that they also equally knowing about the importance of maintaining the temperature, because we know that one is covering will going to prevent the heat loss, and when it is dipped in the oil itself will act as an insulator for heat. Lastly, he mentioned Grita and Saindava should be mixed to induce the Vamana. Grita is a lubricating agent and also Tridosha Shamaka, hence it helps to prevent the injuries during the cleaning procedure. Similarly, Saindava is a liquefying agent, it is Vishandanakara. Saindava is Vishandanakara, so it helps to split and break up the mucus flux or amniotic plugs or sticky secretion, and therefore it is quite easy for the removal. Similarly, in the stomach wash also we are using sodium chloride solution, which is nothing but the liquid form of saline the bowel. Insertion of the index finger also helps to identify the obstructive pathology of the tract. So these are some of the comments which can make and take home message, and how it has to be practically applied in the present day practice. Although the version is older version, the concepts are one and same. The same concept has been today also followed in the newborn care as far as oral cavity and nasal cavity cleaning is concerned, but the explanation is somewhat different. But the main goal and aim and concept, they are one and same. Thank you very much. In the next class, we will see one more important procedure related to newborn care in Ayurveda. Thank you very much.